disease control and prevention, roughly 13,000 women will be diagnosed with invasive cervical cancer caused by HPV this year. Of those 13,000 women, over 4,000 will lose their lives as a result, regardless of screening or treatment. As a mother, I know how difficult it can be to talk to your kids about sex and STDs. But according to the Fred Hutchinson Cancer Research Center, by educating them and having them vaccinated with an HPV vaccine, we will hopefully see a decline in infection rates and make HPV-related cancers almost entirely preventable. I've been a medical assistant for 16 years. The first 10 years, I worked with a dermatology practice, assisting the physician in treating patients with HPV-related disease. The last 6 years, I have worked in a gynecologic oncology practice, helping to care for women with invasive cancers caused by HPV, such as cervical cancer. And I've also been given the opportunity to interview one of the gynecologic oncology surgeons, Dr. Paul Nowitzki, about this subject. As a parent, it was important to me that I had both of my daughters vaccinated with an HPV vaccine and that they were educated on the dangers of unprotected sex. So today I would like to share with you some information about how common HPV has become, how it is spread, and how with the HPV vaccines we can slow the spread of infection. The human papillomavirus, or HPV, is the most common sexually transmitted infection. According to the CDC, 14 million new infections will be reported each year, and over 79 million are estimated to be currently infected, and many are unaware that they have it. This STD is spread by direct skin-to-skin contact, and things like birth control offer no protection, and condoms are only minimally effective. There are over 100 different types of HPV. And the ones that cause health problems, like genital warts and cancers, are called the high-risk strains. According to the World Health Organization, HPV is the main cause for cervical cancer. Now, most infections will show no symptoms, and in a healthy person with a normal immune system, you can clear the infection with no treatment. However, there is a risk for all women that an HPV infection will become chronic and can progress to invasive cervical cancer. In a healthy woman, it takes 15 to 20 years for cervical cancer to develop, and only 5 to 10 years in a woman with a weakened immune system, as with HIV or certain medications. According to Ruth Dunlevy's book, Cervical Cancer, A Guide for Nurses, because of the prevalence of HPV, vaccines have been developed which were approved for use in the US in 2006. These vaccines are our first line of defense against HPV. And it has been recommended that both boys and girls be vaccinated between the ages of 9 and 14 before they become sexually active. For women, a secondary point of prevention is annual screening. An HPV test can be added to a pap smear without having to have any further testing or procedures done. There is unfortunately no recommended HPV screening for men, though they can have the infection and they show no symptoms and can pass this on to any sexual partners that they might have. So vaccination is their best point of prevention. Hopefully, by educating as many people as possible about the prevalence of HPV and the importance of vaccines, we can begin to see a decline in the infection rate and decrease in the occurrence of HPV-related cancer. After talking with you today about HPV, how it is spread, and how we can prevent it through vaccines, I hope everyone has a better understanding of just how dangerous this STD really is. For myself, working with cancer patients of all ages, I have seen many women with invasive cervical cancer fighting and struggling through treatments for a disease that would ultimately take their lives. This is a disease I have seen cause much devastation among families, and this is just one reason why I have chosen to become an oncology nurse and why I've had both my daughters and stepchildren vaccinated. Thank you.